Great. So thanks very much for inviting me to speak at this. It's been a great webinar so far. Really enjoying the conversations here. I'm hoping that I can touch on some of the issues that have been raised in the chat and in the conversation so far around trust and privacy. So from my perspective, I will talk you through some of the development research that we conducted in Ireland, looking at the enablers for digital contact tracing and some of the public perception research and some of the behavioural science issues that we focused on. Then I'll kind of dip into some of the trust and privacy issues that arose during the user experience research, talk you through the data protection decisions that we took and our strategic communications linked to that. And then now that we're in the post-deployment phase, I'll talk to you about some of the regional responses and the data that's been emerging, both from the app and some of our other population surveillance systems. And then about sustaining progress and growth and our monitoring evaluation. So I know there's already been some questions in the chat about, effectiveness, so I can touch on that as well. So, the rationale for these types of apps and, the purpose and all of that has already been spoken to, but I'll just focus on some of the evidence from our scoping reviews and really what motivated us in Ireland as we were connecting across the globe on considering and developing the contact tracing app. So really we were looking at, the functional characteristics, noticing that immediate notifications and integration with community testing strategy was essential. We've already spoken about the challenge and the fallacy of the 60% target for adoption rate and how that's been really unpicked in further research, but the importance of considering adoption and noting that even at low levels of adoption, depending on the approach taken, there can be, significant impact on disease control at a local level and the national trajectory as well. Voluntary adoption was also front and centre of our considerations. This is combined with public trust, engagement and empowering individuals to engage with the collective action around combating COVID. And then the timing of deployment. So we were looking at, when in the pandemic waves was most important, and the evidence was really pointing at the preparedness phase, when restrictions are easing, people are moving around more, and pre-second wave, and that's certainly the phase we're in now. From a population perspective, we focused on the COMBI model for behaviour change, so enabling the capability of people, the opportunity to engage with the product and the device, and the motivation. So again, this is around trust, utility, benefits, enjoying the app as well. This is something that people will be living with and using. So, it has to be engaging and purposeful, and really people be feeling part of the national effort. So some of our public perception research, which tracked from May, so pre-deployment through the development phase and post-deployment, we were starting from quite a high base in Ireland. So first of all, when we saw in some of the other big surveys in Europe, like EU Silk and the European Quality of Life Survey, before COVID, there was already quite a high level of trust in institutions and in the healthcare system. So we were starting from a high base in terms of that. We saw early on in March that 87% of the population felt that technology would help beat the coronavirus outbreak, very high level of trust in the measures being employed by the government throughout, a desire to be able to meet up with family and friends, unpicking at that kind of public sentiment and motivation to engage in public health measures, and then a willingness to adopt contact tracing apps consistently was about 80% across multiple sources of data. The user experience research that we conducted showed that there was consistently confidence in the HSE, the Health Service Executive and the government, and people would be willing to share their data, perhaps more willing than we would consider appropriate, and I'll get into that in a moment. But also people generally felt that using the app would help them feel like they were doing their bit or playing their part in the national effort. So this is just an example of one of the news articles from the Irish Times in May saying over 80% would install the app in order to ease restrictions. So that's what people felt and what they said, but we also wanted to understand the population behaviour more generally as we were seeking to introduce this app and for it to be embedded in people's day-to-day life. So we looked at the last couple of years of data around smartphone use and ownership. So we saw that there's a very high level of smartphone ownership, that health is one of the main reasons or one of the main functions that people actually use mobile apps. So for things like monitoring their own health, managing healthcare, fitness levels, that type of thing. So there's quite a big engagement in health aspects of smartphones. We found that a majority would prefer to restrict or refuse their access to personal data when installing or using the app, and a minority would prefer to restrict their access to geographical location. But what we also found, which is contrary to some of these preferences, that most people reported that they would share quite detailed personal identification details, so name, date of birth, payment details, and contact details day to day in the apps and what they were doing. So what does that mean, for developing this and considering, data and privacy and the principles and issues in developing the Irish contact tracing app? So when we conducted some user experience research with a baseline version of the app, where people were downloading and using a version of the app, we found that there was generally no objection in principle to enabling the Bluetooth function, that permissions should be explained earlier and in full in the app. Most participants were happy to share their data, but actually didn't attempt to read the data protection notice, which we found quite concerning when I get into the point around consent. Some participants asked immediately, what are the GDPR implications of the app? What am I sharing? And what are people, sharing their data for? But generally, most people said, they felt that the app looked trustworthy and that the government branding was actually quite supportive in that trust piece. So that informed a lot of the work and thinking around the development of the data protection impact assessment and engagement with the Data Protection Commissioner in Ireland around that. So first and foremost, the app is voluntary and the legal basis for processing the data in the app was consent. That meant that the data we collected in the symptom tracking function of the app was limited, proportionate, and it was to be used specifically for the purposes of contact tracing and public health monitoring. And these decisions were informed by real engagement with stakeholders, privacy advocates, civil liberty organisations, end users, and the Data Protection Commissioner. And then we took an important step and decision to publish both the Data Protection Impact Assessment, the app source code, and all of the app development research documentation up to that point. We published that ahead of our launch. So here's a tweet from June showing, in our ongoing commitment to openness and transparency in our fight against COVID, here's all the documentation to be scrutinised and the source code to be scrutinised as well. So a lot of this work and thinking, this research fed into our national strategic communications approach for the app. And the first thing that we looked at was, what was the objective of this communication? And it was really about increasing the effectiveness and speed of contact tracing, and the app as being part of significant support in reopening society. So we focused on using national communication channels, public champions, public health officials, and really trusted sources of information, be it television adverts, radio adverts, and weekly press briefings as well with the government. So again, focusing on this collective action piece, we were talking about all being in this together, and that greater adoption leads to greater effectiveness, and that uptake at any level will have an impact, because even one person who's been supported by the app and avoiding one case is a huge impact on one person. So we're really focusing on that collective action piece. So framing the app as being a core behaviour, so a lot of the messaging was very simple: wash your hands, wear a mask, download the app, and also then focusing on the transparency element. So we were very clear in articulating how this was developed, who was involved, what's being used, what data is being collected, and who is processing the data. And that was really about conveying support and trust in how this is being rolled out, and also emphasising that the app is going to be used for a fixed period only. This is a pandemic response app, so really avoiding risks of scope creep or function creep throughout. So focusing on some of the local and regional issues around recovery and our plans ahead. So first of all, the app symptom tracker data is being used by national and local public health teams. Ireland recently published the Resilience and Recovery Plan for living with COVID, and that has 5 levels of restrictions. And importantly, counties in Ireland can be at different levels depending on the indicators in that area. And this is informed by cases, outbreaks and clusters at county level. And then more recently, at a lower level, we're looking at local electoral areas. So this map shows the 14-day incidence of confirmed COVID-19 cases by that local electoral area level. So we can see that there are hotspots. And importantly, with the symptom tracker data that we've collected at county level, you can see an accumulation of symptoms building in particular areas. And that's been we were advised and we engaged very closely with our epidemiological modelers and the Irish epidemiological modelling group around this, about what data would be most useful to support their modelling and their predictions and enhance what we're collecting in terms of cases, incidents and outbreaks as well. So this is feeding into local monitoring and risk assessment at both a regional and a national level. So what now? We've deployed the app, we've blasted through our early adopters, and we're moving into a more challenging phase of sustaining growth. This has been informed by user engagement. So a lot of the feedback post-deployment was around more timely information provided, ongoing updates on the national roadmap and syncing in with that. So more recently, the team have updated what's provided and presented in the app to include more information about daily cases in the last 2 weeks than in the last 2 months, and also to display the number of people who are checking in each day and more information around that. So really encouraging people to continue to engage with the app and see more changes in the app day to day as more kind of an engagement lever. In terms of reliability, there's ongoing improvements there in terms of performance and bug fixing and that type of thing. And that's really important, so that if something arises and it may have an impact on usage and engagement, that it's dealt with quite quickly. In terms of accessibility, the app in Ireland is now available in 7 different languages. So that's quite an important extension of the initial app. And also in those different releases and versions, all of this goes through accessibility testing as well, to try and ensure that the app can be used and engaged with by anyone, and being very conscious of levels of different ICT literacy and even health literacy in Ireland as well. And then in terms of interoperability, I know this has been spoken about already, so just to emphasise that the app is interoperable with the Northern Ireland app, and also that the European interoperability piece is on track as well. So focusing on monitoring and evaluation, so this is a screenshot from the Irish app taken yesterday, but actually these numbers have increased already today. So just to say that in terms of measuring success, this is really about engagement and the role that the app is playing in helping suppress COVID-19 and protecting the population. Okay, so it's not about adoption. Adoption is one small piece. At the moment, there are about 1.3 million COVID trackers. So there's kind of a growing movement. Again, that collective action piece around active users. Over 80% of COVID trackers in Ireland have shared their phone number. So they have opted to engage with the National Health Service through the app, and this shows is a very strong indication of trust and commitment to the ongoing effort. Over 4,000 close contacts alerts have been issued. Over 2,000 users have uploaded their keys so far, and we know that some of these close contacts have gone on to test positive. So what we're seeing there in terms of effectiveness and impact is really app-only contacts going on to test positive, and these are people who would not have entered into our manual contact tracing system if it had not been for the app. So that's a very important piece on the true impact of the app here. And then in terms of symptom monitoring and that epidemiological value piece, over 200,000 users are uploading their symptoms on a daily basis. So we're getting that rolling national picture of symptoms emerging and hotspots before we see case outbreaks clusters as well. So as the saying goes, it takes a village to raise a child. So just to acknowledge here that a cross-governmental and cross-sectoral collaboration really led to the development and deployment of this app. It was an enormous effort and touching on very strong global relationships here. So this just gives you a very high-level overview of the different organisations, governance groups, researchers, technological partners and commercial partners who involved in the effort. The documentation is available on GitHub and also on the dedicated COVID Tracker app. And if you want to get in touch with me or any of the team, just please feel free to reach out. So I'll stop sharing my screen now and looking forward to the conversation next.
Thanks, Sarah, for this interesting presentation. So a quick one. So you talked about the collaboration, about different competences and so on. But so you need also collaboration between the different levels, locally, regionally, and nationally.
Yeah, absolutely. So I think one of the standout processes for me was our engagement with the Public Health Service, which brought in local public health teams as well, and getting their perspectives, and also on engagement with the epidemiological modelers and the National Public Health team as well, to get that full view on the role, purpose and usefulness of the app in the design and in future considerations as well, and engagement with our Central Statistics Office and a cross-governmental data coordination group in how they are using data to convey local, regional and national pictures and changing conditions as well. So I think those conversations and those linkages are really critical when we're gathering an enormous amount of data on a daily basis, to be able to gather insight and convey and make decisions quickly and effectively as well.
Thanks a lot.